Hi everyone, welcome back to the channel. For those of you who are new here, my name is Darren and I'm a third year medical student studying at Monash University here in Melbourne, Australia. Today's video is a little different. I won't be going through anything especially study related, but I thought it'd be interesting to share with you guys what I bring in my bag with me to clinical placement every day. This is a little different to what I brought with me in past years when I was at uni and having normal classes, but now I'm essentially following doctors every day and even my classes are in hospitals, and so I thought I'd share with you guys what I bring, a couple interesting items and some items you would probably expect me to bring as well. So let's get started. First is this bag. So my mum bought me this bag and it's quite a hefty bag as you can see, and I've actually had doctors comment about it. They've asked me whether I had a lot of textbooks in here, which isn't the case, but it carries everything I need, a good lunch and some other items as you will see. And I think it looks very nice as well, and I bring it with me to hospital. Next we have my jacket. So I always wear a jacket every day. May not be this exact jacket, but it is pretty cold now and there is a bit of a walk to the hospital. I'm a student, so I don't get to park in the staff parking. So I wear this into hospital, drop it off at the student common room, and then wear what you see inside for the rest of the day. The hospital is usually pretty well ventilated, so normally not too cold and not too hot. Okay, let's jump into the actual items I bring with me then. They're broadly split into two parts. You have the items that are sort of on me, so adorn me and I wear them. And you have the items that I have in my bag, and there are a couple interesting ones, and I'll explain the uses of them as well. So first, I have my watch. I wear my watch with me every day, as long as I don't forget, for a number of reasons. Firstly, the doctors are on rounds where they see patients for a lot of the day, and I'm with them as well. It's a bit awkward if I need to check the time and I need to pull out my phone, and it's not a very good look, so I'll have my watch for that reason. And it's also very useful for some examinations. So if I'm measuring a patient's heart rate or how fast they're breathing, it's very simple and straightforward to have one hand on their chest and sort of just look at my watch and time it that way. So it's a very good accessory for me to have. Next, you have my name badge. It just says Student Dr. Darren Tan. And it's good to have your name in the hospital because the teams are quite big. Doctors see a lot of people in a day and they can sometimes forget a person's name. And so having my name here means that people know how to address me and know my name. And student doctor is good because it's kind of hard to tell who's who in the hospital. So is that person a nurse, a pharmacist, a doctor, a student? And student doctor just tells people who I am and makes it a little easier with communication and who to deliver news to in the hospital. And I wear it right here. Next up, we have my name badge or my scanner. And this essentially gets me into certain doors of the hospital and also into the student common room. So I just scan it, I go in. I used to have one that was a little niftier. It could clip a little easier, but it broke. And so now I have this one. And I just pop this in my pocket. And it also gives me access to Casey Hospital as well, because a lot of my classes are there. Next, we have two very well paired tools and two very important tools as well. So you have my notebooks and my pen. So at the start of the year, the dean of our hospital really recommended we carry a notebook in our back pockets to write down any information we encountered that was weird or any information that the doctors told us that sort of gave us an aha moment. And the reason I have two notebooks is that one, this pink one here, or changes each time I complete it, but this pink one here at the moment is for notes. So when the doctors have said something, when I see a drug, I don't know what it's for, I just note it down in this notebook here. And this blue notebook is for me to note down patient information when I interview them. So a really important skill in the hospital is to be able to ask patients very directed questions, get their story, and then convey that to other doctors, as well as examine a patient and convey your findings to other doctors and other medical staff as well. And that's a skill important in the future. And so we're really keen on practicing it now. And this is the notebook where I note it all down so I don't forget, and then I can report to the doctor later. And of course, you need to have a pen because you need it to write down. I don't bring a pencil case because it's a little too clunky. And this I just clip on to my belt here. I used to have one in my back pocket. I had two in my back pocket, but I lost them and I didn't want to lose them again. So I bought these key rings and this carabiner, and I haven't lost it yet. Okay, next into some of the more unique tools. First, we have this little pen torch here. Our tutor for one of our classes really recommended that we have a lot of the tools that we need to examine patients. You'd be surprised at how many people don't have all the tools, even doctors. And so I went out and bought some, which is useful for me to use and practice with, but also other people can use them as well. So the reason for this torch is, one, you can look into people's mouths a bit easier. So if I'm trying to examine their tongue or their tonsils, this helps a lot. And also for checking sort of the eye dilation as well. So this is a very good tool for that. And I carry it here with me in my pocket. Next, we have probably the most iconic tool for any medical student or doctor, and it is a stethoscope. And I just have a normal Littmann stethoscope. If you're a medical student, you know there are some different types, but this is just a normal Littmann one. And I wear it around my neck here. Stethoscopes are so important. They have a lot of uses, among them listening to the heart sounds, so seeing if there are any valve problems in patients, which is quite common, and also checking the lungs as well. If there's any fluid in the lungs, any infection, these can help me pick them up as well. So a very, very useful tool, and I just have it around my neck essentially the whole day. Okay, next we have a bit more of an interesting tool here. These are not actually two different items. They are one item which you can assemble and disassemble. So this is what it looks like in its full form. And what this is for checking reflexes. So you have a number of reflexes everywhere. You have a biceps reflex, knee reflex, ankle reflex, and a lot more. These are just good for checking that. So if someone's had a stroke or some other neurological problem, I can use this to test it. You can also use your stethoscope or worst case scenario, your phone, but having this is a lot more convenient. So I usually disassemble this and I put it in my bag here, just in the back pocket, where there's a little more support and it doesn't break as easily. So I just keep it in the back pocket of my bag there. All right. Next we have this nifty little tool here. You can have a guess at what it does, but the main purpose of this is to assess someone's eyes. So I can ask someone to follow this with their eyes without moving their head and see whether their eyes can move quite well. The other thing I can use this for is to check someone's blind spot. So you kind of roughly have a blind spot here. So this for your right eye, here for your left eye. And so I'd ask the other person to cover their right eye and then see where their blind spot is. And you can kind of map out whether they have a big vision problem. This was very hard to buy and find, but I managed to get one and hopefully it stays with me for a little bit of time. And I just keep this in this little pocket up here. All right, next we have my clipboard here. I rarely bring this in with me into class, but there are a couple items in here. You have some attendance for my group. You have some booklets that are necessary for some classes. So if I have those particular classes, I might bring this clipboard in with me, but not a very essential item, and I don't bring it with me that much. But if I did, I'd just pop it in the bag here. All right, next you have probably a very essential item as well, which is my laptop. I also don't bring this in with me every day because I'm sort of in the hospital, I follow the doctors, I talk to them, I do some exams, and then I go home. I don't really study in the hospital or search up things in the hospital, and they have computers as well. But sometimes when we have class and I need to be in the hospital earlier in the day, I just pop the computer in here and then put it in my bag. Okay, and finally, two items that are probably neglected by medical staff and doctors a lot, which is my lunchbox and my drink bottle. I don't usually bring these with me into the doctor's office. I leave it in the student room, but these are very essential, of course. You get hungry throughout the day, you get thirsty throughout the day, and so I always make sure to bring these with me into the hospital. So I put the lunchbox just in the big compartment here, and then the drink bottle just goes in one of these side compartments here. And that is essentially all I'll bring with me to clinical placement. Thank you guys for tuning in to today's video. I hope you've enjoyed it. If you have any questions or you have any suggestions about what else I could bring with me to the hospital, please let me know in the comments below. Enjoy your holidays or the start of term whenever this video releases, and I look forward to seeing you all next time.